Urinary tract infections are one of the most common causes of symptoms of dementia in the elderly. UTIs are pretty common. Upwards of 30 to 40% of the entire population will experience at least one in a lifetime. As we age, we become more susceptible. The symptoms include burning and itching and a myriad of other things. The elderly get those symptoms, and in addition, they will have delirium, hallucinations, loss of motor skills. Sound familiar? Yes. The symptoms that are caused by urinary tract infection in the elderly are the same symptoms as dementia. We are trained to believe that once someone hits 60, every time we forget something, every time something happens, there you go. So it's no wonder that too often something as simple to treat as a UTI can be written off, never treated, because, they got dementia. It's a very simple test to find out. Take a urine sample, take it to a lab or to your doctor, and they'll find out for you. It's important that UTIs get treated. It's also important that they not be mistaken for a more all-encompassing dementia. If you have a loved one who already does have dementia, and that's established, and suddenly their symptoms get worse, get a test for a UTI. Very often, in my experience, that's what's happening. That's what's making it so suddenly worse. Their bodies need the treatment. And once that happens, not only does the UTI go away, but most of the time, their symptoms get back to normal. It's important that you ask your doctor to do this. The good news is that more and more of them do it automatically, but if they don't, you find out about that. And it's important that you follow up. A client of mine had noticed that her mother, who is living in a medical facility, was suddenly starting to show agitation, delirium, and she asked the nurse there to test for a UTI. She had an important business trip, so she left after that. Fortunately, they hire a private aide who attends her mother during the day, and that woman noticed that no such test had been done. So my client had to call from Florida, deal with the right people, and make sure that it happened. Doctors are busy, facilities are busy. Get that done and follow up until you know it's been done. Urinary tract infections are probably the first thing you should look at when signs of dementia appear or when they get worse. In coming videos, we will discuss other possibilities and other things that you can do.